According to the CDC, as of 2024, approximately 5.3% of the US population was experiencing long COVID. That's roughly 18 million people.
This is a Soaak podcast.
Welcome to the Science of Sound, where cutting-edge research meets real-world application. Hosted by Aaron Fournier, this podcast explores the fascinating intersection of sound, frequencies, and human performance. From the science behind bioharmonic resonance to the future of sound-based wellness, we break down the data, the discoveries, and the impact sound has on your mind and body. Let's dive in.
I'm Aaron Fournier, and thank you for joining us on the Science of Sound. Today, we have Dr. Paul Harris in the studio with us. Dr. Harris, thank you for being here.
Well, my pleasure. Once again, I'm excited to share more information with you.
Yeah, absolutely. And as you may remember from previous episodes, Dr. Harris is the medical director for Soaak Technologies. Dr. Harris is a doctor of naturopathy, and he's been practicing in the naturopathic and functional medicine fields for over 5 decades. He's also known as the functional medicine detective. So today we're going to talk about long COVID.
Absolutely.
So when we think about COVID, long COVID, when we think about viruses, how do viruses impact the body?
Well, first of all, those numbers that you alluded to earlier probably are even greater than that, greater than 18 million. I'm seeing in my practice more and more patients present with a lot of long COVID symptoms that are not explainable in any other way.
Well, maybe we should start there then and talk about what are symptoms of long COVID?
The symptoms are one of the primary symptoms. Well, first of all, let's do this. How does the virus gain access to a cell? We've got 17 trillion, 100 trillion cells. The virus is able to connect with the cell through the ACE2 receptor site.
Okay.
And that's the docking station. And so the spike protein, it literally is a spike, actually is like a key, and it docks to the cell membrane and opens the door and gains entry to the cell, and then it starts its replication. So it hijacks the cell, and we just don't have enough defensive mechanisms by default to protect us from those kinds of things.
Okay.
So more and more patients are presenting with headaches and fatigue. Fatigue is one of the big ones. Just chronic fatigue post exertion malaise. In other words, they're just really tired after exercising. Headaches, brain fog is a real common symptom.
How do we know that these symptoms are long COVID attributed versus like chronic stress?
Well, chronic stress indeed can contribute to some of these, but a lot of the patients will tell me, I was fine before COVID, or I was fine before I had the shots, or they were at a dull roar, and then after getting exposed to the virus, then there was a significant uptick and upregulation of a lot of these symptoms. And there's actually, and we'll talk about this later, there's actually some lab tests that can determine if your immune system is really getting after the virus and trying to bring coherence back into your body chemistry.
Interesting. Okay. So now that we have that kind of concept, let's go back and talking about the cell and spike proteins and viruses hijacking our cells. Can you explain a little bit more about that, and maybe how does it impact parts of the cell like our mitochondria or things like that?
So once the virus gains entry into the cell, the body by default then begins to lower energy production, specifically ATP, which is adenosine triphosphate. ATP is what's produced from having breakfast, lunch, dinner, or snacks. The body is able to take the nutrients and the proteins and the fats and the carbohydrates and actually go through the mitochondrial electron transport chain. Out the other end of the mitochondria comes ATP.
And that's literally what keeps us alive.
Exactly. So without mitochondrial activity, you would cease to exist. And so the body begins to shut down the production of ATP and the fuel available. Now, it does that to starve the virus, because a virus does not have an energy source.
Interesting.
It doesn't have ATP.
And so the virus is going after the mitochondria.
Exactly. So in
because
order
that's how
to
it can-
survive and have babies, it needs fuel and energy. And so the body is lowering the production, the energy production, to starve the virus so the immune system can then destroy the virus. That's typically the way it works, unless unless you've got a compromised immune system or the body forgets to reset. And once the virus is gone, in many cases, the immune system still thinks there's a virus and is continuing to stay in the sympathetic mode and hunt the virus and go after the virus. It is not really the problem at that point in time.
Right.
And so then if you don't have enough ATP and all of these things are downregulated, then it affects a lot of other organs and systems, which we'll talk about in a little bit.
Okay. So I don't want to derail the conversation, but you mentioned that the body reduces its energy production, reduces its ATP whenever we recognize, the body recognizes that there's a virus, there's some kind of immune response that needs to happen. I can't help but think about previous conversations on this podcast where we talked about fasting. And does fasting potentially, just a quick side comment, does that help with the body's ability to heal and process from viruses?
Yeah,
Is that a different type of energy?
Yeah, that's a fair question. Well, when you're fasting, that does a lot of magical things to your biochemistry and to your cells, and it basically propagates autophagy, and that's where the body basically destroys and gets rid of old dead cells, sick cells, etc. So I think it's a great adjunct to an actionable plan for people that are struggling with long COVID, which, by the way, those symptoms primarily it occur if your symptoms continue like 2 to 3 months after you've had the infection. Most likely it's long COVID, and thankfully now we've got some labs that can determine if indeed that's the case.
Okay, interesting. So you mentioned organ systems. So we talked kind of at a cellular level, some of the things that happen. What organ systems are impacted by long COVID?
So one of the things that's interesting that happens is you've got the HPA axis, hypothalamic pituitary adrenal axis. The hypothalamus is a prime regulator of all things body. And so
it's like your control center?
Yes, it's a control center. So the hypothalamus uses more energy and more fuel than any other organ or gland in the body.
Wow, okay.
And so if the energy level is not restored, the ATP level is not restored, since it's power hungry, then it starts to sputter and it goes offline. And so it's like a circuit breaker in the brain.
Wow.
And so when that happens, then that affects everything under the umbrella of the hypothalamus, which we can talk about
else.
that. So when that happens, one of the things that is significant, the hypothalamus, for example, controls sleep. And 60% of the patients that have long COVID tend to have sleep problems and sleep issues. And then the thing, if you're not sleeping properly, then that can affect your brain's ability to detoxify and cleanse during the night. So then you end up with brain fog and things
all
like
kinds
that,
of other
and
problems.
short-term memory. So it affects sleep. It also affects hormones like adrenal, thyroid, sex hormones, etc. So it affects all of these different systems. But one of the things that it really impacts is the cardiovascular system.
Okay.
And we're seeing, especially in long COVID, long vax patients, are presenting a lot of complications secondary to the initial exposure. For example, I have a journal, Radiology. Now I'll just read it for you. This is assessment of myocardial FFDG uptake at PET, CT, and asymptomatic SARS-CoV-2 vaccinated, non-vaccinated patients. So basically, to simplify it, it means that they did a PET scan on patients that were vaccinated and patients that were unvaccinated. Now, the FFDG is a radioactive substance, glucose-based, that's used in medical imaging where the cell takes up the radiological material via the glucose as a transport mechanism.
So they can see how it's moving
So they
through
can
the body.
see more with a lot of specificity. So here's the background. And I quote, patients who develop myocarditis after SARS-CoV-2 vaccination show abnormalities on cardiac MRI scans. However, where the myocardial changes occur in asymptomatic individuals after vaccination is not extremely well established, and more research is being done. Now, the conclusion of this test was, when compared with non-vaccinated patients, asymptomatic patients who received their second dose of vaccination 1 to 180 days prior to imaging showed increased myocardial FFDG uptake. What all that means is, looking further in the study, it means that these individuals, they had abnormal PET scans on the heart, but yet they were asymptomatic. They were not, had no symptoms whatsoever.
The only
I know
difference-
this for a fact because I've got a doctor, an MD, that's a patient that I did an autoimmune test, and this individual showed autoimmune markers affecting the myocardial tissue. Yet this person was asymptomatic.
Right.
Totally shocked. So the document shows the PET scan on a normal heart, and it's real light in color. And then the ones that were vaccinated, it showed the PET scan, and it had a dark region, dark area, which indicates that there were problems and issues, yet that individual was asymptomatic.
Interesting.
So, I mean, we've got documented proof that this is indeed
there are unintended consequences.
What's going on. And that's why one needs to be proactive. And if they've had, the standard therapy and treatment for COVID, and they've had COVID, there are a lot of tests that can be done to determine, as you look under the hood, that, okay, there's some problems developing, and the train's left the station, it's not arrived at the destination. And my job as a functional practitioner is to determine how far down the track you are, and then make some course corrections so that you don't end up in the hospital with a heart attack or a stroke. And so that's one of the things that we're seeing. So the virus can potentially impact and cause heart cell damage. It can cause blood clots. It also can cause myocarditis and pericarditis. So that's the pericarditis is the envelope around the heart. Myocarditis is the myocardial tissue itself. So we do know there's a lot of issues pertaining to the cardiovascular system. Now, to continue this conversation, the other system that's affected when there's a lowered energy is your autonomic nervous system,
which is fight or flight.
And this is your fight or flight. So the autonomic nervous system, you've got a sympathetic, fight or flight, brace for impact, and parasympathetic, which is rest, digest, I'm healing, and I feel safe. Mm-hmm. It's like a seesaw. So you want a balance there.
Well, I think we should go into that a little bit.
Sure.
Because when I think of sympathetic and parasympathetic, I think, well, no, I always want to be in rest and digest. I want to be healthy. But that's not necessarily the case. There are times where I want my body to be in fight or flight mode.
You primarily want to be in the rest, digest, I'm healing, and I'm safe. Now, we could go a little deeper in the weeds, and then there's what we call the polyvagal theory, and it's like a traffic light. You've got green, go, everything's good. Then you've got the yellow, which is caution, and then you've got red, which is stop. So the green is everything's good, but then when we are in sympathetic dominance, we're in fight or flight. That's the yellow light. You reach the point where your resources are exhausted, you're mentally exhausted, physically exhausted, you just can't take anymore, and you curl up in the fetal position and you're basically non-responsive. That's the freeze frame mode.
Okay.
So your body's saying, okay, I've had enough, I'm done. So you can vacillate between the yellow and the red. And so we have markers that we look for that can determine if that's the case. Now, in many cases, our COVID patients, they're stuck in a sympathetic dominant mode.
So they're stuck in
they're
that
in a
yellow
constant
light,
fight or
red
flight.
light.
That's also the cell danger mode. That means that your cell,
it's a lot of stress.
Your cell is basically using a lot of your body's energy resources to try to fight off whatever it's trying to fight off, whether it's a virus or other types of toxicity,
or potentially fighting itself.
Exactly. So then you don't have enough energy for energy.
Right.
And you've got just enough to keep the lights turned on, and you can't, play the stereo and the vacuum cleaner and the dishwasher, et cetera, just enough to keep the lights on. And so those resources are going to the fight or flight to protect your cell.
Right.
that's where a lot of the COVID patients are.
Okay. And so how it's really then just tied to the energy production side of this is how long COVID is impacting our ability to switch between fight or flight and rest and digest, the sympathetic and the parasympathetic nervous systems, or are there other things going on besides just the energy production piece?
Well, it's not just the energy production, it also can impact the cell. Then you've got molecular mimicry, where there are substances, viral particles, persistent viral particles, that basically the immune system can mistake as tissue. And so then the immune system gets in a state of confusion, and then it does attack self. And that's when you do the blood test, basically showing autoimmune markers.
Okay.
And as I alluded earlier,
right.
that one marker indicated that there was an autoimmune process going on in this patient's heart. Now, let me just say this as a side note. You've got 3 stages of autoimmunity. You've got silent autoimmunity, and this is where you've got elevated antibodies, but no symptoms and no tissue destruction. Then you've got autoimmune reactivity, and this is where you now begin to present with symptoms.
Okay.
Then the 3rd stage is you've got complete tissue destruction. An example of that would be autoimmune thyroiditis.
Okay.
Now, you can start out with just elevated antibodies, and then you go to
which you wouldn't necessarily notice.
Exactly, and then autoimmune reactivity, and then you've got full-blown thyroid issues. Now you have fatigue, you've got heart racing, and just all kinds of weird symptoms going on. And you go to the doctor, and then he or she will do a blood test, not just a TSH, but they'll do a TSH, a T4, a T3, a TPO, which is thyroid peroxidase antibody, and TAA, thyroid globulin antibody, and reverse T3. Most doctors, unfortunately, just do a TSH.
Okay.
You could have a normal TSH, but have elevated antibodies. I see this all the time. So that indicates that now we have, with an elevated TSH, which is hypothyroid, now you've got tissue destruction. So that's the 3rd stage. Going even further, you can have stage 1 with, say, a pancreas, and then stage 2 with a thyroid, or stage 3 with an adrenal.
So when we talk about kind of that
it gets very complicated, very entangled, and that's when one has to really do a lot of investigation and do the right kinds of lab tests.
Well, and that's for your analogy, the train has left the station. This is, you're talking about the train's left the station and you're asymptomatic. You don't even know.
Right.
But there are tests that can be done to show that, hey, something is happening in the body that we need to pay attention to. And by the time most people go to the doctor because they've been feeling bad for a month or 2 or 6, they're already further down the track, and there's potentially damage that's happening. And then that's where you're talking about, it all gets entangled, and that's a lot to unravel.
And these tests aren't routinely used. These are specialty tests. They come from CLIA certified labs. But it's a very important test to determine the balance of your immune system. As a matter of fact, it's called the Cyrex lymphocyte map test. But let me preface that by saying there's 2 arms of the immune system. It's important to understand this. There's 2 arms to your immune system. You've got Th1 and Th2. And the Th1 side is your innate immune system, the cellular immune system. That's what you're born with. That particular arm of your immune system is weaponized to go after viruses, bacteria, fungal infections, things of that nature. Then you've got the Th2, which is the adaptive immune system. That's the humoral side, produces a lot of antibodies. And you see an upregulation of the Th2 side, particularly if there's asthma or parasites, allergies, and things of that nature. And again, you want that seesaw to be balanced. So what happens is, in many cases, the patients with long COVID are stuck on the Th2 side, producing a lot of antibodies. It's not resetting to balance out with the Th2, Th1 side. So we see oftentimes a reactivation of, say, Epstein-Barr, because they're stuck on the Th2 side, which inhibits the Th1 side, which is the side that keeps your viruses in check. Now you end up with a jailbreak, and you get a reactivation of Epstein-Barr, and then the patient says, "Oh my goodness, I feel like I've got mono all over again."
Right.
And that's because there's an imbalance and a dysregulation between Th1 and Th2 and T regulatory cells and Th17 cells and all of these different types of cells. And so there are tests, to your point, that helps to differentiate between the two and what's going on. Now, this is not just a hematology evaluation. Okay. This is looking at specific biomarkers on the surface of the cell. So it does an immunological phenotyping to determine. For example, I just happen to have a copy of this test somewhere with me. And again, it's called the lymphocyte map test. And this particular test result, it shows it'll actually show a Th1 Th2 ratio. So I can look at
where you're at on that seesaw
and determine where you are on the seesaw. For example, in long COVID, I typically see a lot of type 14. Let me just give you some information on that. Immunotype 14 is where you've got a high antigenic load, including environmental toxins and viral infections and things of that nature. But here you have too few CD57 cells, natural killer, and T cells. Well, this test actually shows this particular patient had very low percentage of natural killer cells, total CD3 cells, low CD57 cells. This provides immunological specificity. Now, why would we need that? Because a lot of people depend on Dr. Google. and they think, well, I've got an immune problem going on. I need immune support. So here's what they do. They'll order an immune stimulating product.
Right.
And they feel worse. Well, here's the problem with that. The formula they took, if they were, let's say, upregulated on the Th2 side, the formula they took was more polarized to support Th2 arm of your immune system.
So all they did was make
and
the side
now
that was already
you're,
imbalanced
you're,
more imbalanced.
You're adding more fuel to the fire, and they feel like crap because it's making them worse. So when in reality, you needed to support the Th1 and enhance the T regulatory cells. So that's why it's not wise just to, especially with immune formulas. I mean, one would say, well, these are just all natural. Well, that's true. That's fair. But however, it's still propagating a pharmacological effect. So you're still it's still having a drug-like effect without the side effects. So one still needs to know with specificity, what part of my immune system is this going to affect? What part of my adrenal glands is this going to affect, or thyroid, or whatever? So using natural therapeutics, one needs wisdom and needs wise counsel from someone that knows what they're doing.
Right. And the right tests to be able to see what exactly
and know what
test
what test to order. Yeah.
Well, I think that's really valuable because I don't think about my immune system as having two different sides. I think about my immune system as my immune system, right? As one entity, one organ system. And so thinking about it as a seesaw where there are these two levers and we want balance, we need to be able to switch from one side to the other and also have a balance between the two, just like we do with the autonomic nervous system, switching from that fight or flight to rest and digest, and that leading to, healthy function in the body.
Well, and this is the beauty of the functional world versus conventional medicine. There's room at the table for both of us. So I'm not knocking conventional medicine. However, the cases that we're seeing are so complex and convoluted. One has to really realize we're systems, and all the systems communicate with one another.
It's all interrelated.
You, Aaron, are more than just a brain or more than just a heart or a liver. And just to focus on a symptom, we need to look at cause and effect. If all one does is focus on the effect without addressing the cause, you're kicking the can down the road, throwing mud on the wall, and hope some of it sticks. And in many cases, you can make the patient worse. So you've got to have biological and immunological specificity. Otherwise, it's just guesswork.
Right.
And the patient, unfortunately, ends up paying the price.
Right. Because if all you're doing is just covering up symptoms, making symptoms go away, as you, again, bring back that analogy of the train, that train has already left the system.
Exactly.
And the train is moving down the tracks at a point where it's showing symptoms, which is why you went to the doctor.
Exactly.
And you're covering that up, and it's on its way to the destination, which is somewhere that you
and
don't
in a lot of
want to
different conditions, the symptoms are so overlapping. it makes it difficult. So the doctors typically just say, here, take this anti-this and anti-that, and come back and see me in a week or
Right.
whatever. When you really need, it's so complex, you really need to go much deeper. You spend more time with the patient. Most doctors spend 8 to 10 minutes in a doctor's office visit. Well, we spend up to an hour and a half.
Right.
Because if you really are going to get to the root, and we are a root cause clinic, then you've got to spend time with the patient and actually listen to the patient and do the appropriate paperwork and have them. And we have patients fill out extensive paperwork. They'll bring in their lab work, and oftentimes I'll look at the lab work and I'll ask the patient. I'll glance at the lab work and I see things that I know aren't right. And I'll ask the patient, so what did your practitioner tell you about your lab work? Oh, everything's normal. So it appears as if it's got to be 25% or more above or below normal before there's even a conversation about it. Even borderline low or borderline high, some individuals can present just as many symptoms if it's borderline as if it's completely out of range.
Well, because that's taking an average of the average sick person as
Exactly.
well. It's not taking an average of the average healthy person.
Exactly. So, your norm may not be my norm. And so just because you fall in the normal range doesn't mean that you are, because it's, you've got to use a few brain cells and again, spend enough time with the patient to figure out, okay, maybe your labs don't show that they're off the rails, but you're moving in that direction. And if you project where you are now, 3 years down the road, it's not going to be a good hair day for you. And that generally gets their attention.
Yeah. Well, you've definitely piqued my interest. I think I want to get a Th1 and Th2 test done now and see kind of where I'm at.
It's a great test. I've employed this particular technology in lab work for several years, and it provides a lot of specific information that helps patients get out of a deep rut.
Yeah, absolutely. And then you mentioned also that natural supplements, things that people could be taking. Do we want to talk about some of those
Sure.
things? What I know you also cautioned, right? You don't just want to take something because you don't know where you stand and what you really need to be done. But what are some of the things? What are some foods? What are some supplements that people could be taking to help them with their stress, help with the autonomic nervous system, to help with their immune system?
Okay, I'm not suggesting that your people that watch the podcast go out and just buy these products and take them, because one needs to know, do I need them? What's the dose? And what's the best brand, et cetera. And a good place to start here is with NAC, N-acetylcysteine. A lot of your educated viewers know what NAC is. As a matter of fact, if you went into the hospital with an overdose of Tylenol, they would probably give you high doses of NAC, N-acetylcysteine, which is a natural supplement. Because when you're exposed to Tylenol, it depletes your liver's supply of glutathione, which is your body's master antioxidant. And so they need to rapidly upregulate glutathione.
Okay.
And so NAC has been around a long time. As a matter of fact, it's so effective. At one point in time, we were fighting the FDA. They were wanting to take it off the market. And anything they want to take off the market that's natural, we're over the target. And you know that it's effective.
Right. So
the form of NAC we use is a special NAC called ANAC. I learned about this through a group. I'm part of a group called Zero Spike. And this is a group of doctors and practitioners and scientists from Milan, Italy, and really all over the world. And so we collaborate on what works, what doesn't work, what lab tests to do, et cetera. Just trying to stay on top of our game with the emerging problem with long COVID and a lot of other issues. And so I learned about a special form of N-acetylcysteine called augmented N-acetylcysteine. Regular N-acetylcysteine, and by the way, the reason you take N-acetylcysteine is it denatures the spike protein. It detaches the spike protein from the ACE2 receptor site and then eliminates it that way. But it only is effective about 15 to 30%. The augmented NAC that I learned about is 99.8% effective in denaturing the protein. They expose the NAC to a plasma field, lines up all the little soldiers. It makes it much more effective.
Okay.
and it works great to upregulate glutathione, which in long COVID you've got glutathione deficiencies in many cases. So that's one of the things that we use. It's great for liver detoxification. It's not a prescription, and we typically dose it like 2 or 3 in the morning on an empty stomach. Another formula that we use is C15, or it's called fatty 15. This is the first essential fatty acid discovered in over 90 years.
Oh, wow.
And it was discovered through research in San Diego. I think it was the Navy that was doing the research on the dolphins and the health of the dolphins. And the healthier dolphins that were able to sustain a lot of stress, and they were using the dolphins in military purposes. Mm-hmm. The ones that were the healthiest had higher levels of this strange molecule, and they figured out it was C15.
Okay.
And so it's now available as a supplement. I've used it in part of my strategy to reverse and treat fatty liver and things of that nature. But more importantly, it helps to repair and restore mitochondrial function.
Got it.
And it's important to repair the cell membrane. Your cell membrane is 50% protein and 50% fat. And so the cell membrane is actually the brains of the cell. It's not the nucleus of the cell. This is where cell-to-cell communication occurs. And so with the virus and oxidative stress, the cell membrane becomes damaged. That fatty portion becomes damaged, and then there's a lack of communication. And just about with anything, if you don't have communication, there's not a good hair day either. That includes biochemistry. So the fatty 15 effectively helps to repair the cell membrane. So now you're getting better cell-to-cell communication, and when you're taking nutrients, the nutrients are actually making it into the cell because you're repairing that weak cell membrane.
Yeah.
So that's one of the things that we love. Natozyme is another product. It's a nattokinase, and that actually helps to dissolve blood clots, and it's used as part of our strategy. It helps with the cardiovascular system and is part of our strategy and an actionable plan for long COVID.
But you would only use something like that if you saw on a test result that there was a need for something like that, right? Like what would you be looking for?
We would be looking for abnormal cardiometabolic numbers,
okay,
and lipid numbers, and elevated LPA2 and different things like that. So here's the other, back to the cardiovascular. The spike protein damages the endothelial glycocalyx, which is that slippery gel-like lining of the pipes called your blood vessels and arteries.
Yeah.
So what happens is it causes potholes in your arteries, kind of like Oklahoma. Roads are potholes.
Right.
You can tell from one state to the next, oh, I'm in Oklahoma now, so the road starts full of potholes. Anyway, it damages that delicate lining, and you want your blood platelets and blood cells to flow freely through that pipe. So the real pathogenesis of cardiovascular disease is not cholesterol, but it's endothelial damage and lesions in the lining of the arteries.
That's fascinating.
And so this promotes inflammation and disruption in the integrity of the lining of the arteries, the endothelial glycocalyx. So here's what happens. Now your blood cells are flowing through, and it snags in that pothole. Mm-hmm. It releases another chemical called, I'm going to get a little technical, thromboxane A2, which causes vasoconstriction.
Okay.
At the same time, it creates clotting. This is the same phenomena that occurs when you cut your finger.
Right.
This is why you don't bleed out.
Because but it shouldn't be happening inside your
you damage the
arteries.
platelet, the cells release thromboxane A2, your capillaries, or cut yourself shaving, then your capillaries constrict, it produces clots, and that's good. But it's not good if it happens inside your arteries. You get enough of that going on, then you can start to produce clots, which is evidence in a lot of these cases, and cardiovascular issues. So in that case, we need things to clean that up and correct it, which is correctable.
Well, and that could even lead to brain fog, right, as well, if it's restricting blood flow, especially in the brain.
Yeah, and
that reminds me of like traumatic injury, like traumatic brain injuries, concussions, things like that. And one of the things that the brain does to heal itself is constrict those areas, which is reducing blood flow. And it's maybe good for a limited amount of time, but you want that to open back up. And so,
yeah, and I'm glad you brought up brain fog again, because there's another, as a side note, there's another piece of that, and that is a lot of the long COVID patients have gut issues. 80% of your, or up to 70% of your immune system is in your gut, and so if you have a compromised intestinal barrier, aka leaky gut, then you're leaking things into the bloodstream that don't belong there,
right.
and that triggers an immune response, which promotes inflammation. Now, if you happen to have elevated LPA, lipopolysaccharide, then the damage is not between the cells, it's literally through the cell. And then what happens is it damages your blood-brain barrier. And now you're leaking peptides and toxins and things through the blood-brain barrier into the brain, and that's what contributes to a lot of brain fog, neuroinflammation,
wow,
and things of that nature. So that is a piece of the feature and characteristic of long COVID.
Well, and then when those things are releasing, and I remember from a previous episode, you were talking about things releasing from the gut and going into the brain,
Exactly.
and that's your immune system's basically following that path. And
yeah, you've got neurons in the brain, then you've got microglial cells, and the microglial cells are the immune cells, and it does a good job of cleaning up the debris, the cellular debris, and the brain is like this pristine environment. It's the prima donna, and it's special features and things that the rest of the body doesn't have.
Yeah.
And that blood-brain barrier is highly protective of the brain, and so anything that compromises it.
But leaky gut is a big threat.
Leaky gut can contribute to a compromised blood-brain barrier. Now that sounds horrible, but it's one of the easiest things to repair.
Okay.
And we actually have a blood test, of course, that shows if you have an impaired blood-brain barrier. So we can do a baseline and then do 3 or 4 months later say, oh well, your blood-brain barrier is intact. The same thing with fatty liver. We have a blood test that we use as part of this feature, that is 98% as accurate in determining if you've got a fatty liver as if you went to the hospital and had a biopsy.
Wow.
And so these are, as we look under the hood, these are some of the things that we look at, because that's not a test that you typically get done in your standard metabolic panel.
Right.
So the next thing that we use in terms of nutraceuticals is drainage activator. And this is an important topic, because if you're mobilizing toxins from intracellular to extracellular, which you want to do that's appropriate, then it goes from there to your bloodstream, and from your bloodstream it's carried to your liver, and then your gallbladder, and the gallbladder dumps it in the small intestine, and then it goes from there to the kidney or the bowels to be excreted throughout the body. That's the way it's supposed to work.
Right.
A lot of these long COVID patients, and other patients don't even have long COVID, those excretory pathways, exit pathways are blocked. And now what happens, you move it from inside the cell, outside the cell, starts down into the bloodstream, and it goes from the kitchen to the bedroom instead of out the back door or back into the TV room. You can make the patient worse. So if we're going to get rid of some of these spike proteins, which, by the way, they will stay in your body forever unless you do something specifically to denature those spike proteins, load them up in the garbage can and carry them out.
But then you need some kind of carrier, some kind of binder to help.
We do have some special binders that sit in the gut, and it binds to these things to prevent reabsorption and moving things from one part to the other. This also has carbon technology. It doesn't just sit in the gut. It also, the molecules are small enough to go to the brain and load up some garbage in the brain and help to facilitate removal out of the
Which
tissue.
can help with the brain
So
fog.
this is where, again, a lot of people, when they go on a detox program, they feel worse because their detox, the exit door is all blocked and jammed up.
Right.
And that's one of the big mistakes that even natural doctors make. You've got to clean up the pathway first. You've got traffic jams in the road, and you're just making things worse.
Yeah.
And so this is one way to enhance that.
Yeah, you're doing the right things, but you're not finishing, you're not following through with a full protocol.
And then we have another formula called foreign protein cleanse. I don't have time to get into all the details, but it helps to facilitate the denaturing of these abnormal proteins and things of that nature.
Wow.
I also use soak frequencies.
Yeah.
and it helps also with coherence and detox and stabilization. I use the Sleep Well, since 60% of long COVID have problems sleeping. There's also a frequency composition, Cardiovascular, which helps to support that. And I think there's one that's the coronavirus support.
Yeah.
So this is very gentle, and one doesn't have to worry about side effects and things with the frequencies. So I just use a combination of all of it. Each case is different. There's not one size fits all. We're all metabolically different. And again, if the doctor doesn't spend enough time to look at all these different facets and dynamics of what's going on, you just miss the boat.
Well, at that point, you're getting a generic solution that was created for the average unhealthy person.
Exactly.
And it's not looking at you
Right.
and what your body needs and the markers that you're showing.
That's what you call molecular biological specificity.
Well, this was awesome. Thank you so much for coming and sharing all this information with us today.
Well, it's my pleasure. Look forward to doing it again.
Awesome. Thank you so much.
You've been listening to The Science of Sound with Aaron Fournier. If you found today's conversation insightful, be sure to subscribe and leave a review. For more resources on frequency-based wellness, follow along at Soaak Podcast. Until next time, keep listening, keep learning, and stay in tune with the science of sound.